geriatric practice at Beth Israel Deaconess Medical Center has been around for many, many years. We usually consider anybody over age 65 to be able to join our practice with the goal of trying to keep people healthy and independent. We tend to see the patients who have perhaps memory loss or osteoporosis, or they are losing their balance a little bit. So we get a lot of people who either want to be very proactive and prevent these issues from becoming too overwhelming in the future, or we get a lot of requests for consultation.
When my mom was still alive, she had taken a fall, had been in the hospital, and then they sent her to a rehab center. I called her PCP and I said, my mom needs to see somebody who can make a really good assessment as to what her level is now and will be going forward. The recommendation was made to see Dr. Salomon. And so I brought my mother in there, and at the time she was 93. Immediately, the reception staff, the nurses, and Dr. Salomon made her feel so at ease. And it was as if my mother just went like,
we can help people get through this chapter of their lives a little more easily.
I had such confidence in seeing how they handled my mother that when my husband needed to find a new PCP, it was a no-brainer. I said, Suzanne Solomon.
As I age, I really have been very fortunate being very active. I have not experienced the difficulty that a lot of my friends in my age group have. I do not suffer from any arthritis or pain like that. However, I had other issues. My blood disorder, which causes me to have blood clots, which have caused me a lot of concern.
Ed had a very minor stroke, and Dr. Salomon saw him immediately. She assessed him, and he had some issues with it. Primarily, it was balance and gait. She went right to work and she got him admitted to the stroke service. And I think it's because of her being so vigilant that he doesn't have any of the issues that could have persisted.
So how have you been feeling?
I've been feeling very well.
We all work together to manage the patient's multitude of issues that often do come up as one ages. The teamwork is so important. You know that you have been seeing a lot of physicians.
That I have.
And as you know, I find whether they're inpatient or outpatient, the care is sort of surrounding them. That there is a whole family of doctors, nurses, therapists, that we're all working together with the same goal. And not only does the patient feel reassured that everybody is working together, I, as a physician, feel reassured. Excellent. No crackles.
You're not simply a patient. You're not a record number. You are a person. It comes through in all of their interactions.
It's a pleasure, as always, to see you looking so good.
It does give peace of mind knowing that I have someone who cares and is taking a personal interest in my case. And I'm happy to say when I am doing well, they actually express how happy they are to see that I'm doing well. In the future, I look forward to staying strong and continuing to age gracefully. I want to stay active and go forward and enjoy my senior years.